Welcome to Nature, the Drug of Choice. I'm Valerie, the hypnotic hiker, coming to you today as Valerie, the clinical hypnotherapist at the Flow Center. This is episode 20, entitled How to Change the Change Naturally. More specifically, a woman's experience with the change of life, also known as menopause. Normally, I talk about the natural world and hiking and how it can shift our perspective, how to help us to release an old idea or think up a new one. So, if you're new to this podcast, go back and explore those other 19 episodes. But today, we're taking a new trail. We're talking today about what I think are the two most misunderstood topics in the universe: hypnosis and menopause, with my guest, Dr. Kate Naumes. Dr. Naumes specializes in menstrual and hormone health for women, helping her clients live healthy, vibrant lives from preconception through menopausal stages. Her deep knowledge of the female hormonal journey enables her to create highly tailored and effective healthcare solutions that cater to her clients' unique needs. She holds a doctorate in naturopathy and a BA in biochemistry, among other certifications, and is highly trusted as a naturopathic doctor with 16 years experience. Welcome, Dr. Kate.
Hi, thanks for having me.
You bet. These are the two most misunderstood topics, right? Hypnosis and menopause.
Absolutely. I'm so excited to talk about this today because you are right.
Well, we'll jump in there. I have some questions, but let's talk about, what is naturopathic medicine? What is menopause?
Absolutely. So, naturopathic medicine uses natural remedies like therapies including herbs or botanical medicine, exercise, referral to body work or hypnosis, and nutritional counseling to heal the body. And a lot of people in this country can call themselves naturopaths, but naturopathic physicians, which my training is, or naturopathic doctors, go to accredited 4-year graduate level schools where we study the basic sciences, much like conventional medical school, but we also study nutrition and psychology and the complementary therapies like herbal medicine.
That's such a great distinction. I find that in the practice of hypnotherapy or hypnosis, that there's varying levels, and someone could say, "I'm a hypnotherapist," and they've had 150 hours of online training. So I'm glad you made that
Right.
distinction. So when someone's
Yeah.
looking for a naturopathic physician or doctor, what is the designation? Is it ND?
Mhm.
They need to have an
It's
ND.
ND, but also make sure they went to an accredited naturopathic medical school.
Okay.
And another way you can double check that is you can go to the American Association of Naturopathic Physicians website, and
Okay. Okay.
only those that have passed their board exams and are licensed can be on that website.
Okay. Okay. Great. So let's talk about I know you did some work when I first met you. You were doing work with preconception, and you had the
Yeah.
bunny. And as I've aged and as you've aged, our client base has aged, and I'm
Mhm.
helping women more with evolving into their 60s now. So tell
Yeah.
me how your practice has evolved from, when you first
Yeah.
started.
Yeah, that's a really good question. So when I went to Bastyr, which is the naturopathic school I went to, I was doing my naturopathic degree and I also trained as a midwife. So when I graduated, I was really focusing on fertility, pregnancy, postpartum care, and well woman care. But when you become a midwife, you learn a lot about continuity of care, which was always really attractive to me to stay with my clients throughout the lifespan.
Mm,
But because I was only 28 when I graduated, I didn't feel like I had the wisdom. I maybe had the scientific knowledge, but not the wisdom
yeah.
to help women through perimenopause.
Yeah.
And as my clients are now like clients that had babies in my practice, 10 years ago are
Yeah.
now in perimenopause, menopause. And so we've grown together, and I've gotten more continuing education and more accreditation so that I could feel competent in helping them through menopause. So it's been a real joy to have that continuity of
Yeah,
care.
absolutely. Okay, so let's talk about your latest certification from NAMS as a
Mhm.
menopause practitioner.
Yeah, so that's the North American Menopause Society. And it's the same accreditation that an OB-GYN or a primary care doctor would get if they wanted to have specialized certification in menopause. And for listeners, I would absolutely recommend that you find one of those practitioners like myself when you're looking for menopausal care from a primary care doctor, an OB-GYN, or a naturopath. And we study for a big test, and we have to pass a test. And then every year thereafter, we have to continue with continuing education specifically in care of the menopausal woman.
And I'm just reading from your one of your blogs, you talk about being only one of 10 NDs in the US that is
Yeah,
certified.
yeah. And I
Mhm.
think that over time, more naturopaths will become certified
Mhm.
um, because it's such a good fit for our field. But yes, in this country, I counted as of like a month ago, there aren't many of us that are both certified as a NAMS practitioner and an accredited naturopath.
So, um, menopause has a lot of different phases, perimenopause, menopause, postmenopause, which I guess I am in. I want
Mhm.
to talk, I want to say something about my relationship with Dr. Kate. I was working with her probably 10 years ago. I was in my early 50s, so yeah, I guess 10 years ago. And just as a well woman, I just wanted to be as healthy as I could be. And she was asking me some questions, and I was talking about my sleep. And I said, well, I wake up every night between, I don't know, 2, and I'm up till 3:30, and I'm just doing stuff. And then I fall back to sleep, and I feel great the next day. And she goes, huh, well, when was your last period? And I said, I guess like 2 years ago. And she goes, well, you're in menopause. And I'm like, what? Is this what it feels like? Because I feel great, So
Totally.
I didn't notice the symptoms because I didn't expect it to be horrible. My mother never said anything about it being horrible. I never anticipated. I just thought of myself as this active young lady that was just eating well and exercising, and so I didn't even notice that I was going through it. So talk about your ideas about that, about mindset and
Yeah,
expectations.
yeah. I absolutely think that mindset and expectations play a role. And I'll loop back to that. And then I also think the more menopausal and perimenopausal women I treat, I have so many healthy, active women in my practice. Women who have been eating well for a decade and exercising and meditate and have happy relationships. And then for them, menopause hits and it's brutal. They
Oh,
get brain fog and they get hot flashes. And so I have been surprised at how it really depends on the woman. But the thing that I will go back to about mindset is there are so many, and culturally too. I work with a lot of Mexican American women. It just happened to be I had one patient and then got a ton of referrals within that community. And now that's a significant part of my practice. Your cultural beliefs about your value as a woman and your
mm,
cultural beliefs about what menopause means do
mm-hmm.
seem to drastically impact the mental and emotional experience of menopause. So, if your cultural beliefs are you're only valuable as a reproducing fertile woman
Mm,
and as a mother,
mm-hmm.
then the mental emotional piece is more brutal and harder for women
Yeah,
to get through. Versus if your cultural values are you are now a wise woman and you are free to experience yourself fully and powerfully, and you're a crone, then they have a different mental and emotional experience for sure.
yes, I would agree. Thank you for that.
Yeah.
Let's go back and talk about what perimenopause, menopause, and post. Can you talk about like the age range and sort of what's going on?
Yes.
Okay.
Age range, late 30s to
Wow.
55-ish. Now I'll go into detail. So
Okay.
perimenopause literally means around menopause. So
Ah.
it refers to the time before and shortly after menopause. And menopause is when your periods have stopped completely for 1 year due to your aging eggs and ovaries. And when those ovaries age, you stop making estrogen and progesterone. So perimenopause is around menopause. Menopause is easier to recognize because you just don't have your period anymore. So you had
Mm-hmm.
12 consecutive months of no menstrual bleeding.
Mm-hmm.
And perimenopause is actually those highly symptomatic years.
Mm-hmm.
And usually women have the most symptoms the year before menopause, but many women will have perimenopausal symptoms for a decade before menopause. So sometimes women are starting to have perimenopausal symptoms in their late 30s.
Wow, that's a long time.
Yeah,
Okay.
I know. An average age of
You know.
menopause in this country is around 52.
Okay. I think that's when I did
Yeah,
it. I'm not real sure
right. Yeah,
when I did it.
yours was so smooth.
When my
Yeah.
eggs when my eggs said we're done, you're a crone now. Actually,
Yes.
I did have a crone
Yes.
ceremony when I turned 50. I thought I should have done it. I should have waited till I was 60 because but I thought at 50 it was like, "No, you're a crone now." But
Yeah. Now you need your Crone 2.0.
that's right. That's right. Now we're pausing for station identification. The Hypnotic Hiker presents Nature, the Drug of Choice. Hypnotic trips, if you will, virtual hiking experiences, mind trips that offer a shift in perspective. Basically, these are a series of guided journeys that take you back to your true self. In these episodes, you'll discover the true power of your unconscious mind and how to change old, outdated programs from birth that have kept you stuck. You'll enjoy some virtual hikes, some hypnosis, divine interventions. You'll learn walking meditations. By the way, I've been a clinical hypnotherapist since 2002. We'll explore the importance of staying connected or reconnecting to your wild child, to be in touch with our primitive minds, our instincts. We'll talk about how the modern world has tried to change us into cogs of a machine. I'll dive into mass hypnosis and the concept of transhumanism. We'll even explore regenerative ranching and agriculture. The most important discovery you'll have is how to lose your shadow self and how to love yourself again, standing on your own 2 feet and thinking from your heart mind and speaking with your true voice. I'm Valerie, the Hypnotic Hiker. And now we're resuming our conversation with Dr. Kate Naumes. I know I wanted to say HRTs, but I know people may not
Yeah.
know what those are. But the hormone replacement therapy,
Yeah.
you do advocate for that in some cases and some levels and reasons why. So talk about when it's a good idea to do hormone replacement therapy.
Yeah. So, as a naturopath, when working with clients, I'm going to support them with nutrition, with exercise, with healthy lifestyle choices, stress management techniques like hypnosis, and education. And then I'm going to use prescription medications when they're evidence-based and when they're going to help my patient.
Okay.
So, in the situation of hormone replacement therapy, menopause is a hormone deficient state. We do become very, very low to non-existent in estrogen, progesterone, and also sometimes testosterone. So hormone replacement therapy is replacing the progesterone, the estrogen, and potentially the testosterone that we no longer make after menopause. And we know that hormone replacement therapy helps prevent osteoporosis and bone loss. And we know it helps with hot flashes. So those are two situations where if there's a family history of osteoporosis, I am 100% going to recommend it
Mm-hmm.
because fracture risk is a very real risk for American women, and we suffer from it and we die from it. So it's important to prevent osteoporosis, and
Mm-hmm.
estrogen does do that. And hot flashes, which we're going to talk a lot about with hypnosis, um, are treated very well with hormone replacement therapy.
So if
So those are
somebody
two
doesn't
situations
want,
where I'll definitely use it if they want it.
if they want, so if they don't want to do that, then you would go with suggesting the hypnotherapy for hot flashes. So tell
Okay.
me what the NAMS, I believe it is, that organization that you had your
Yeah.
certification in, they did a lot of research and presented some studies on how
Mhm.
hypnosis can help. And you thought, I know a hypnotist, right?
Yes, exactly. Right. So, like I was saying, I am a big advocate of hormone replacement therapy, but I know it's not for everyone. Some women just prefer natural remedies for different reasons, maybe religious beliefs, just maybe preference, and others are actually advised against HRT for health reasons.
Okay.
For example, breast cancer is such an interesting discussion to have. Two randomized controlled trials reported conflicting outcomes of breast cancer recurrence with hormone therapy. So
Mm.
some breast cancer survivors make the decision with their oncologist not to use HRT.
Mm-hmm. Mm-hmm.
So I may have someone come to me who had breast cancer in her mid 30s, and she had surgical menopause because of her breast cancer treatment. So she has no ovaries anymore.
Mm-hmm.
And her doctor has specifically said no estrogen for you because of your type of breast cancer.
Okay.
And she is having hot flashes that are preventing her from sleeping.
Mm-hmm.
And when we don't sleep, we do not feel good. So that would be a perfect candidate
Okay.
for hypnosis.
Okay. So, how do you feel, or why do you think hypnosis is helpful for that?
Yeah. Well, there have been multiple rigorous trials where hypnosis was shown to reduce hot flashes and night sweats, both in survivors of breast cancer and in the postmenopausal woman. So it's evidence-based, which is
Mm-hmm.
super cool.
Mm-hmm.
I think it's
Yeah.
just so cool.
There's a link in the show notes to several studies that I came across, and we can talk about those, or I can put those links. But um, anytime there is there are some studies out there, especially Psychology Today, Baylor, and then that group that you're associated with, and also the NCBI, National Institute of Health, I think is one of them too. So there's some pretty big names that have done these. These are not just obscure studies.
Right.
And I've, my practice has been going for about 22 years now. And one of the original ideas that I had was to work in this area. Um, my instructor really encouraged me to look into working, with menopause, but now I really want to say perimenopause.
Absolutely.
That's
100%.
really more of the phrase to use now that I understand it better. So it's nice to come back to this. And I know one of the points that was made in one of the articles was that hypnosis can change our fixed ideas about menopause, perimenopause, which is what you were talking about, with mindset. So our fixed ideas that it's going to be horrible, that in
Yes.
hypnosis we call those identifications and associations. Well, mom's menopause was horrible. I hated my mother for 10 years, because of
Yes.
it.
Yes.
So then the other part of it is the symptoms can be uh, transformed in using hypnosis, with like hot flashes. You can imagine cooling down, so the symptoms can be reduced through visualization, through direct suggestion. I had a client the other day who called it what I do, Val's visioneering instead of engineering, that using visuals to visioneer what you really want. And then the other thing hypnosis can do through these points that were made in this article was to help instill or create healthier habits. So if
Mm,
someone has a bad sleep, routine, or if they're not eating well, then hypnosis can also help to encourage the subconscious where those habits are, to shift those, maybe change the motivation, the desire, the goals for those habits. So
yeah,
they're more interesting to the unconscious, and so it's easier. Like self-control is hard without, your
right.
subconscious going along with it. So it helps bring in that, I think it's best way to term it's inner conflict is now inner cooperation.
I
So
love
what else do you want to say about hypnosis for perimenopause?
Right. Well, what everything you just said makes me think about our increased risk of cardiovascular disease once we go through menopause. And so it's so important to have healthy habits in place, eating fruits and vegetables, exercising, getting good sleep, going to the doctor to check your blood pressure. And so hypnosis can help you establish and
Mhm.
build all those healthy habits and break the blocks that are preventing you from taking good care of yourself, and preventing things like cardiovascular disease and diabetes, which our risks do go up after menopause and are very linked to lifestyle habits.
So why do they go up? Is it lifestyle habits only, or why
No,
does it go?
it's because of the low hormones, which is another reason why I'm such a fan of hormone replacement therapy. It's a
Hmm.
combination of genetics, history, and hormones.
Hmm.
But when estrogen, one piece of it is that estrogen is anti-inflammatory. So it's protecting our cholesterol levels, it's protecting our blood pressure from going up, it's protecting our brain. So when we lose that estrogen, if we don't replace it with hormone replacement therapy, that low estrogen is directly impacting our cardiovascular health because of blood vessel health and inflammation.
Well, darn, I haven't had any estrogen in 10 years.
Well, but here's something about you, which is interesting. Women who have more hot flashes are at increased risk of cardiovascular disease compared to women who don't.
Mm.
So, as someone like yourself who just had a very easy menopause experience compared to the average woman and didn't have a ton of hot flashes, it also shows the innate health of your cardiovascular system.
It just really speaks to when you're in your 30s, adapt some really good, healthy practices, and then you get to be vibrant and healthy in your 60s.
Yes,
I think.
I would love to see a study where women in their 20s and 30s have really good health. They don't have
Mm,
obesity, they don't have high blood pressure, they're eating a Mediterranean diet, they're exercising, and
mm,
seeing how they go through menopause compared to
yeah,
women
yeah,
who have different lifestyle habits. Let me let my dog out.
okay.
Yes, I would love to see that.
Mhm.
But it's fascinating. But estrogen is really good for us. So when we lose our estrogen, our bodies do have negative consequences.
I read Suzanne Summers' books about her love of
Uh-huh.
estrogen and
Yeah.
the way that she would do the rotational diet, or where you had to eat a fat with a carbohydrate, but you couldn't eat a fat with a protein or something like that. And it was I did
Mhm.
that for a while. I cooked like she did for a while, and she really helped me understand the importance of estrogen. But I didn't have a good person like yourself to guide me through that. I just thought, oh well, I'm in menopause, so I'm okay.
Right.
I felt okay. But
Yeah.
looking back now, I wish I would have maybe had a little more estrogen. I don't know. Is it
Yeah.
too
And how
late?
many?
Is it too late
Yeah.
for someone in their 60s?
No, it's not. And I mean,
Okay.
honestly, I bet there are a lot of listeners who would be interested in this very topic
Okay.
because I do
Yeah.
think your generation and beyond
Yeah.
is noticing all the research that's coming out right now and hearing all the talk about it because w- healthcare providers are really advocating for women right now for menopause, and it's a great sea change, if I'm using that word correctly,
Mm-hmm.
phrase correctly. Um, so hormone replacement therapy is safest to take when you're younger, to start taking when you're younger and closer to perimenopause, menopause. So ideally, you start your hormone replacement therapy as soon as you're having perimenopausal symptoms when you're pretty young. And there's some data that shows that with after 10 years of menopause or over the age of 65, there are more risks associated with it, but it does not mean that it's not safe or not worth taking.
Mm-hmm.
Um, so you absolutely might still want to consider hormone replacement therapy,
Mm-hmm.
and you just want to take the right dose and the right type. So, for example, we don't want to take oral estrogen. Ideally, we take transdermal through the skin
Mm-hmm. Mm-hmm.
estradiol, which is
Mm-hmm.
E2, um, because there are more risks with oral estrogen, especially the farther we out from menopause. So, there are some ways around it for sure.
Okay. So how well actually, let's talk about your quiz. I took the quiz. So tell me about your quiz and who should take it, what they can expect from it.
Yeah, it's a cute, lighthearted,
It
fast,
is. It is.
but it does take into my 16 years of experience helping women. And so it helps you kind of stratify. Are you on a fertility journey? Are you on a preconception journey? Are you in perimenopause? Are you
Hmm.
dealing with painful cycles and PMS? Are you possibly dealing with polycystic ovarian syndrome? And then after you take the quiz, you get some advice from me on
Yeah.
next steps.
Yeah.
Yeah.
Okay. So the quiz is in your social media on
Yep.
Instagram, and I'll put those links. Can they also find it at your website?
Yep. If you go to my website, it'll pop up.
Okay.
And you can also, if you're on Instagram and you follow me, you can DM me the word period, PERIOD, and the quiz will be sent directly to you in your DMs. So there's a couple ways you can find it.
Okay. All
Yeah,
right.
and I'd also like to make a plug for people who are listening that are really interested in perimenopause. I do have a podcast out. It's a private podcast, 5 episodes where you hear two of my patients talk about their experience in perimenopause, and
Okay.
I talk very in detail about perimenopause. So if people want more information, there's that as well.
Okay. So should they DM you in Instagram to get that as well?
Yep, so they can find the link on Instagram in my link tree, or they can DM me pod as in podcast.
Okay. All right.
But mostly, I want people to listen to the hypnosis that you did for hot
Oh,
flashes.
yes. So Dr. Kate contacted me and asked me to create a hypnosis script. And we did that, and it is available. So if you sign up for my newsletter, you get that download, and the newsletter will be about hypnosis, some self hypnosis tips, just some general information about it, but also how you can use hypnosis specifically in these different stages of the change. And does anyone call it that anymore? The change of life, you know?
I don't hear anyone call it that anymore.
Yeah, I'll probably
But
change the name of our podcast.
it is very appropriately named the change because it's
Yes,
as significant as puberty.
yes, and it's a lot longer. It's
Yeah.
a lot longer.
Yeah.
Um, so you said the private podcast of perimenopause, it's available. Some of your clients talk about their story. Can you just give us a quick example of some of your recent client, and you call them clients or patients?
In Oregon, they're patients because I'm fully licensed to be a primary care physician. And if
Okay.
my clients are outside of Oregon, I'm doing consulting and I call them clients.
Okay. Okay. So could you talk about some of the successes that you've had with those individuals?
Absolutely. I mean, I have clients come to me with perimenopausal symptoms associated with weight gain, especially around the tummy, which does put us at more risk for cardiovascular disease and diabetes, hair thinning, memory issues like word recall and brain fog, insomnia. And when we've worked together, we've helped them lose that weight around the tummy and decrease their cardiovascular risk. We've helped to get their hair to be back to nice and thick and lustrous. Of course, the word recall and memory issues can be really scary and frustrating. Women are like, I can't remember basic words. Do I have dementia? Do I have early Alzheimer's? And sure enough,
Mm,
it's perimenopause.
yeah.
So through naturopathic medicine and hormone replacement therapy, because our brain really loves estrogen, they feel like they get their brain back. Um, and it's just been extremely rewarding to work with the menopausal woman. I am loving it,
Yeah.
and I am surprised at how effective naturopathic medicine is for this patient population.
And it is as a woman, at women in general that are the wives, the mothers, the professionals, and everything that we are, and men are great too, and they do a lot of things too, but men don't have to go through this
Mhm.
15-year, the childbear, all the hormonal shifts. Women have so many more hormonal
Yes.
shifts. And are we getting to a place in society where that's more accepted, that men are more understanding, that, I mean, what is your take on all of
That's a,
society's
yeah. No, I don't
with
think
that?
society is there yet. I don't think they understand it all. There are obviously individuals and partners who understand and are supportive, but um, I don't think at large we understand what a big experience perimenopause is for women and how impactful it can be in all aspects of life, from their sexual drive to their physical health to their mental and emotional health to their general sense of well-being to their vitality. Um, and like you said, we're going through menopause when we're taking care of children and aging parents, when we're working full time.
Yeah.
It's as much to ask of a woman as having a baby in that early postpartum phase.
Hmm.
And we're just meant to do it kind of in secret.
Yeah.
And we shouldn't have to do it in secret. We should do it with support and love and community and understanding. Um, so I really hope that this wave that I'm seeing right now of well-educated female practitioners speaking up about this and talking about it and educating our patients about it does make a change where we really value this time and we
Yeah.
also take care of women during this time.
Yes, to value. I know in hypnotherapy with sessions with my clients, um, to embrace what is so important. That they've got a weight issue. They do better when they can embrace what is and say, yes, here we
Yeah,
are, but I want to go that direction now
yeah,
instead. And the concept of that is so difficult to just embrace and allow and be with what is, but it's from that place you can move out of it.
mm,
And I'm going to do what I can do with these, with the social media, with podcasts, with blogging, to talk about how natural and normal and how long this hormonal shift is really dragging out and playing out. It's like nearly all of our lives that we run around pretending to be okay.
Totally.
I don't know, just blowing some words out
Yeah,
here.
absolutely. I mean, we are fluctuating from like age 13
Yeah,
until
and
54.
forever. Yeah. To me, I mean, I still
Yeah.
feel that now. I mean, I have every once in a while I'll feel a kind of a wave of something come over. Can't think of words and, I better eat some more walnuts or something.
Yeah.
But anyway, I could talk a long time about all of this, as I know you can too.
Yeah.
But I know you've got to get on and start seeing
Yeah.
some of your patients, your clients today. So what else would you like to add to this conversation before we close it
Yeah.
out?
Yeah, well, because this is about the hypnotic hiker, I do think the natural world plays such an important part in our ability to take time to relax and rest and recover and center ourselves.
Yeah, yeah,
So I think it's so important to take a hike, play in the river, go to the arboretum,
yeah,
garden, breathe in some fresh air. It's such an important part of self-care. And
yeah.
I think that the other thing that's so important for women is community with other women.
Hmm. Yeah, because it's really at a time where you just want to shut the door and say, "Leave me alone." And maybe you
Yes,
can do that for one day, but don't
yes,
stay there. Reach
yes.
out, reach out.
Right. Ask a
So,
friend to go on a hike and talk about your perimenopausal
yeah,
experience. Yeah.
all the other hikers will just love that, right?
Yeah.
So thank you, Dr. Kate, and I will link everything in the show notes. I appreciate your time and your insights and just how you view the beauty of life and women and how everything is just perfect like it is, but we can certainly start shifting at that as well. It doesn't mean we have to stay where we are.
Absolutely. Thank you
Okay.
for having me.
Thank you. Enjoy the rest of your day. Don't forget to go to the show notes on the podcast app where I will list how to get in touch with Dr. Kate for general questions, also to read her blogs, access to all the research that we talked about. And if you want to ask me some specific questions about hypnosis, because I really didn't cover how that worked in this particular episode, you can follow me on Instagram, the Flow Center for Hypnosis, and send me a DM, and I'm happy to answer whatever questions you have. Thanks for joining us. This has been episode 20, Nature, the Drug of Choice.